Good afternoon, I'm Dr. Marc DuPere, plastic surgeon in Toronto, and today I would like to discuss a procedure that's relatively rare and not done by many plastic surgeons: hip augmentation with the silicone implant. Hip augmentation is a common request in my practice from two different populations. I do have females, tall, slender, who are lacking the curvature on the outer thigh area. The curves are back in America: breasts, buttocks, hips. So there are ladies who are very flat over the pelvic area, and we will add an implant and or fat grafting if there's enough fat for me to work with in order to give them back the curves. The other group of patients I work with are the transgendered male to female patient, and we have one today. Those patients commonly will have tip refinement on the nose, they will have Adam apple reduction, they will have breast augmentation, and today we're doing a hip augmentation. So if you come a little bit closer, I've done my pockets. This is an under fascial and under muscle placement. This is where I want to place my implant. I've made an incision about 6 centimeters. And I am inside, under, if you come a bit closer here, I am under a muscle layer into the fascia, and I've created a pocket inside to give her an outer thigh augmentation. So I will show you my implant. This is a silicone elastomer implant that I use for this purpose. We go right into the pocket, and the implant is gently inserted like we would do with a pec implant, calf implant, buttocks, and breast. Thank you, you can come out. And the implant is nicely secured all over this area to give an outer prominence, and the implant is centered over what we call the bony prominence, called the greater trochanter. Now this depression here is lacernine, will be gone when the patient is standing. So hip augmentation is commonly performed in my practice. If the patient has more fat to give, now this patient is very athletic, there's no extra fat for me to work with, but like we do with the Brazilian butt lift, where we harvest fat from unwanted areas and we transfer into the buttock, we can also do this with the hip augmentation. Sometimes patients want me to augment the area between the hip and the buttock to create more the Kardashian rear end, so to speak. In those situations, because we have no implants to go in that particular position, I will add some fat grafting. Thank you very much.